Hey everybody, Tom Flynn here, and you're watching TMI Video Podcast on LinkedIn. And today I am joined by Gil Bashe. Gil is the managing partner for global health at Finn Partners. And most of you know Finn Partners. It's the fastest growing PR and global integrated communications agency in the world. Gil, thank you so much for joining me today.
Tom, it is such a pleasure, not only to be in your program and the format, but also to speak to someone who cares so much about these issues as I do. It's a delight.
I appreciate you saying that. For me, it really begins and ends with patient care. We have a population of people that rely on our healthcare system. And just by taking it serious, focusing on it, making tough decisions, but right decisions, we can make our population healthier. That's worth everything. So,
the issue you raised with that is, and we'll get into this concept of drivers of health innovation, which is what brings us together today. We're living in a very, very fragmented health system here. We're seeing it unfold or unravel before our very eyes with COVID-19. I think to get a vaccination appointment for myself, it was 196 redial calls on my cell phone until someone finally picked up. So trying to fix this system is exactly what you and your listeners are doing, and I salute you.
So much to discuss. You made an interesting distinction there. You said, watch it unfold or unravel. And it is such a delicate balance. You talked about the vaccine. This is a fresh story in my mind. I heard about it last night. We have a prestigious hospital in my area. I won't mention it, but the COO got walked out yesterday because he nabbed a couple of the vaccines for a couple of, now they're higher ranking officers in our community. So you could argue that, they could have made a list, but he appointed, a couple of vaccines for them and he shouldn't have. They were out of sequence. And it's funny. It's that delicate balance of unfolding and unraveling and access to the vaccines and watching this play out in front of us has really been an education. I think we're still learning. We're still figuring out what's happening.
Yeah. Well, there's two eyes here. There's the sense of innovation, which is what we'll talk about for a bit, and integrity. Regardless of how the health system evolves, in the face of its fragmentation, in our desire to fix that, there's integrity. Let's not ever question the integrity of health delivery. That's disappoint us, whether it's someone putting aside vaccines for someone who's out of sequence or playing with Medicare reimbursement. Regardless of the issue, integrity is the bedrock of medicine. Innovation is the game-changing element that moves care closer to people, but it has to be with integrity.
That's fantastic. And I think you just put your finger on like the sore spot, which is everyone just observed in the last 9 months. It wasn't enough that we were under assault from a global pandemic. Almost every image we saw on TV broadcast to us questioned the integrity out of hand, or we had a minute to think about it and then the talking heads came on and questioned it for us if we didn't. And that was almost more unnerving than the pandemic itself.
Yeah. We're in this period of coronavirus chaos. And the chaos is amplified when we don't have clear information. We don't have a sense of clear leadership. In this nation, this amazing nation, we really have 51 health systems. We have a federal government, which is trying to set policy or move things forward to facilitate through the fragmentation. And then you're in California, I'm in New Jersey, New York. Each state has its own health system. And therefore, each state is bidding and buying through the federal government vaccines and supplies and masks, personal protection equipment, and the cascade of events that goes on. They're setting their own policies of who gets vaccinated and when. So if you're on the New Jersey-Pennsylvania border, you don't know if you should run across the border to get vaccinated or stay in your home state. That's really where the innovation around information becomes so mission critical to such a large fragmented health system. A lot of the drivers I talked about in that piece, if you dissect them, they're really about, forget about whether it was this widget or that widget, It's really about accessing information faster, clearer, for the sake of delivery of care. And that's the drivers, I think, that will make the biggest difference in society, which are tools that bring the point of care and the people who deliver that care closer to the people who need that care.
Actually, we're probably getting ahead of ourselves a little bit, which is fine. But you referenced the piece that you wrote, and I did want to refer back to that. I don't think we've mentioned that yet. One of the reasons I got in touch with you is in December, not long ago, you had published the top 10 drivers for 2021 healthcare innovation, which I thought was fantastic because it wasn't the top 10 innovations, it wasn't futuristic technology, it was the top 10 drivers. So instead of pulling us into the future and some sort of like Blade Runner, thermal visor or AI, you talked about what are the drivers we're living through right now. And I thought that was such an interesting distinction.
Very astute distinction, Tom, and I appreciate that. Look, there are catalysts for change. To say that the Apple Watch 6 is a driver would be incorrect. The driver is our need to really slice out all these pieces of the information collection system and make it faster. So a driver might be decentralized clinical trials. To ask people who have a health concern to go to a major medical center to participate in a clinical trial when they live 50 miles from that center, but they need to participate in the trial because it may lead to breaking research that saves a child's life, is arduous and unnecessary. We have the ability to transfer information from our wrists to doctors sitting in Boston, though you live in California. So a driver are tools often that make information sharing more complete. Now, COVID certainly is a big driver, but a lot of the things I mentioned in that piece, they were in the works. They were operational well before COVID. What COVID did was whack away some of the obstacles to those drivers being like, I've got to do it. And why? Well, people need to make money. Our machine moves by payment. Payers paying doctors submitting bills for fee for service, doctors affiliated with hospitals getting a piece of the revenue. It's all about the economics. COVID is both a pandemic and it is an economic game changer. Obviously for the worst, we know that. But for doctors to say, I can't see patients, they don't want to see me, and I don't know if I want to see them in my office. That made telehealth a go-to solution. The driver of telehealth is actually the personalization and rapid access to care. And even specialty departments dividing their services where it used to be, Tom, 1 day a week you're on grand rounds. Now it might be, Tom, 1 day a week you're on telehealth services for these patients who have this rare disease. COVID is changing behavior patterns and enabling those technologies to take hold. That's why we look at them as drivers, not as just pure innovation. Drivers change mindsets. Drivers change behavior patterns. The health system is essentially stuck in the 1970s. I often think, something, we've got space-age medicine and it's driven by a hamster wheel. We've got to align the two. We can't have Fred Flintstone driving research laboratories, right? Yabba dabba do is not an answer to people who have life-threatening illness.
Okay, I'm with you on everything you say. Let me share an anecdote because it's not just the limitations of our system. It's also the mindset and bureaucracy. And I just want to share one thing because for telehealth, which you put, high as you can on your list, this has been talked about for decades, certainly for the last decade, certainly as all of our video conferencing technology spiked even before we were forced to, live the last 9 months at home. But before March, the statistic was that 9% of doctors had tried telehealth. When I went to CES in 2000, 2020, I just snuck out there to Vegas before the shelter in place, before the pandemic took root. I was talking to a couple different providers that were talking about these landmark decisions about patient privacy and about security and about freedom of information. And they were saying, well, telehealth, can't happen, or a lot of these, advanced technologies will never happen because of laws associated with patient records and privacy. And all that makes sense, but there had to be a way to get both in play. And it was a lot of bureaucracy gumming that up. So now it went from 9% in short order to the last statistic I read, this is the end of last year, 2020, 93% of doctors were engaging in telehealth in 9 months after we'd been debating it for
Why
10
is
years.
that? Two reasons. Policy shifts, right? Greenlighting telehealth. Sort of saying HIPAA can be addressed through telehealth as well. You don't need a fax machine any longer. Let's unplug the fax machine between doctor offices. So that happened. And guess what? You don't see any patients. You can't recommend anything for them. What does that mean to the doctor? I can't earn a living. I went through medical school to treat patients and earn a living. I can't treat patients. I can't earn a living. Telehealth. So economics drives a lot of these innovations. I'll touch on something that I think is really important. Clinical trials. It's a huge multi-billion-dollar industry. But more important to you and me, out of those clinical trials comes new medicines, like COVID-19 vaccines.
Right.
If I can't do a trial, I can't discover a vaccine or a treatment for a rare cancer or another disease. I can't do anything. The Clinical Trial Research Organization of the biopharmaceutical industry said, wait a minute, the pipeline of drug development will dry up unless we reconfigure. We need to embrace decentralized clinical trials. We need to reorganize our mindset of how we engage patients, how we engage the system, how we collect data, how we process data. All that is changing before our very eyes. There's an amazing organization right now called the Decentralized Trials and Research Alliance. 100 companies, major companies in our country, have gotten together to work collaboratively to redesign the clinical trial process. Why? It didn't work optimally before, right? We knew that. COVID-19 said it's not working at all right now. And guess what? Even for cancer trials, I think cancer trials dropped by about 50% of moving them forward because of COVID. Mental health dropped almost entirely. Obviously, we needed to reinvent. These technologies I write about are the tools, the vehicles that allow us to actually imagine or reimagine how we do clinical trials in this country.
Okay, this is fantastic. And also, I love the passion that I'm getting from you here. I did have a question, though, if everything, or I shouldn't say everybody, but most people I know just want to get back to the status quo. Most people I know just want to get back to the status quo. They want the vaccine to work. They want to go back to work. They want to go to ball games, etc. My question is, and it's hard to have this crystal ball, assuming the vaccine takes hold, we become healthier, we become protected from the virus. Do you feel like we would lapse back into the status quo, things moving like molasses, or have we created an irreversible conversation about this innovation and the speed of innovation that there's no going back from?
Well, I'll first give a contrary answer. Yes to both of those options, right?
Okay.
There will be people in the system who sort of say, now I can go back to my old way. There will be people who say, no going back. What's the difference here? This is a little bit like post-World War II, women in the workplace. When men marched off to defend the free world and during World War II, women were more than ready and capable of filling their roles, and then some, and then some. There was no going back. There was no going back. Some people reverted back to a traditional household lifestyle. Most people didn't. We're going to see that. Certain things, though, have to change. We've got to push the change on. One, access to care, telehealth. In most developed nations, if your child gets up in the middle of the night and is screaming sick, you can use the telehealth system of that nation to be in touch with a health provider at 2 a.m. instead of trying to either run to an emergency room, which is expensive and frightening for the child. So these sort of systems are now in place. We have a lot of innovative and entrepreneurial health professionals who will see this door opening as an opportunity to improve the delivery of care. So I think you're going to see a blend, not this or that, and both. I think you'll see the fact that primary care has shifted over to walk-in clinics. We've lost the relationship with primary care physicians. We do these walk-in clinics now. You'll see people bringing this to another level of care. So I think we're going to see a little bit of both, Tom.
Okay, Gil, unfortunately, that's kind of about all the time we have, although I feel like you and I could probably do this for another.
Maybe we'll do it again. Maybe
Yeah.
we'll do it again. I just want to acknowledge you and the program format. I invite people to read the piece. Hopefully you'll share a link.
100%.
And I also invite your listeners and viewers questions. Always. I'm here to help. You're here to help. Together, let's improve the health system.
Okay, and I will. I'm going to put a link to the article. Also, I'm sure throughout this I'll have been posting the list so people can kind of get acquainted with it. Also, just to kind of find you on LinkedIn, again, it's Gil Bashe. I have your name there on the screen with Finn Partners, and just a fount of information, really good information. And again, promoting health and healthcare and how do we drive innovation. Gil, this has been an absolute pleasure. Thank you so much for joining me.
So today. Welcome. Mm-hmm. So welcome.
All right, everybody. And once again, I'm Tom Flynn. Again, I've been with Gil Bashe today. And this has been another episode of TMI on LinkedIn. Thank you so much for joining us.